and her parents. I'm sorry, go off. Well, I'll just do it. I was going through some of my mother's old things. My mother died 10 years ago, and it takes me 10 years to actually open the boxes, you know. So I was going through, one of the boxes, and I found instructions for going to Annapolis on the bus to fight for the first parity law, right? And I was like, and that really made this last one very depressing in some ways, that we aren't further, but recharges you. What? I can find out. Well, oh, it was early 90s, yeah. Because we had the first one in the state. In the country, right? Thanks to NAMI, a lot of NAMI advocates especially. Anyway, I'm sorry, this is Kate Farrenholt. You've met me before. I'm really here to introduce Moira Moynihan Cyphers. And how many of you have met Moira? Okay, so I don't really have to introduce too much about Moira except to say that Moira has had multiple relationships with NAMI, all good, I hope. Her current relationship is having served as the president of our board, been on the board, been involved with NAMI, cares about our issues, then left the board so that her firm, her government relations firm, so that we could enter into a contract with her government relations firm so there was no conflict of interest, and really also because we wanted Moira as our consultant, not just her firm. She's since gone to another firm, and we're very excited about the team there, which is actually the same team we were working with before. But anyway, Moira is phenomenal. She knows legislative and regulatory, health policy, backwards and forwards, and she's also not like me in that she can make it simple. So I'm going to leave it there, and or not simple, clear. How's that? Moira, come on up and educate us. Thanks.
Thanks for the kind introduction, Kate. And it sounds like it's been a great education conference so far, and I really appreciate folks sitting in on my session. Like Kate said, I have been involved in some capacity with NAMI for, gosh, probably 6, 7, 8 years, maybe? Yeah, close to a decade anyways. I was brought in by Don Slater and Tina Slater a long time ago to help advise the Public Policy and Advocacy Committee when they were doing bill review, because I had been staff over at the State House and the House of Delegates. I worked for a member who served on the Health and Government Operations Committee and also the State Appropriations Committee. And then during the interim, I did a lot of local and state campaign work. I also spent time at my boss's federal health policy firm and worked on federal issues, doing research, meeting with members of Congress on behalf of their bevy of nonprofit clients. So I really do, I have a strong health policy background, and I have been working in Maryland politics and a part of the legislative session in some sort for over a decade. My first foray into work here in Maryland was with a grassroots issue campaign. Worked with Maryland Citizens Against State Execution, working to pass repeal of the death penalty. We were eventually successful, and thankfully the member I worked for, Heather Mazier, got involved on a number of other great social justice issues, including marriage equality. So I know what a grassroots battleground fight looks like, and I also know how to get things done in Annapolis. So it's a pleasure to be working with NAMI, and especially now for the past few weeks to a month, in a larger role than more just kind of strategic advice and doing a lot more of the advocacy. So hopefully I won't have too many I don't knows, but Jess left some pretty big shoes to fill, and Kate is just such an expert, so I'm sure you're well aware that NAMI Maryland is in great hands, and I look forward to a successful session with you all. So that's me. Yeah, thank you. And like it says, it's partner, so I'm part of a women-owned lobbying firm, one of the very few in Annapolis. We struck out on our own. It was a big risk, and so far so good, and couldn't be happier. But yeah, it's time to bring a little bit of new blood and fresh perspective and opportunity for folks like us with families. Also, I'm a mental health consumer. Okay, that's enough about me. So very technically for NAMI, I'm a contract lobbyist, and here's a quick list of things that I do. Working through Kate Fair and Holton staff, so I'm never on the ground, I'm never making decisions without the advice and consent of the organization. So right now we're working to build a legislative strategy. Further on in my talk, we will talk about some of the issues we're kicking around for session, but legislative strategy means meeting with stakeholders, whether it's elected officials, state agencies, county officials, the Mental Health Association, the Behavioral Health Coalition. We work with a lot of legislative partners. So figuring out who's doing what and who would be responsive to what and balancing priorities is what we've got going on right now. I advise and develop priorities, and so that is with Kate, the rest of the NAMI Maryland staff, NAMI Maryland grassroots members, and the board of directors. So it's a little bit of an approval process, but it's to make sure that all stakeholders within NAMI are engaged and that we've got the best advice and folks who are willing to testify and do meetings and advocate on behalf of these priorities. So the more collaborative we can work together, I think the better buy-in and then the better results for NAMI. And then down in Annapolis, and through the interim, I'll be leading advocacy efforts. So in Annapolis, it's pretty cut and dry. It's working on bills, it's working on the budget, it's amending bad bills or trying to defeat them. During the interim, it's working with legislative coalition partners. It's following through on implementation. So if we get a budget increase like we did last year for behavioral health providers, we need to prevail upon the governor to actually pay those rates. So the work doesn't stop once session ends. It's really a year-round process. And so it does slow down, I would say July, August a little bit, but really we're busy all the time trying to get the state to implement the bills that we pass. Collaborate with legislative coalitions. I've already touched on that, but NAMI is involved or a part of, in some capacity, over, I think, 60 groups and subcommittees. Yeah, we've got a Google Doc, so we prioritize those. But Kate has been appointed by the previous governor, and I think Governor Hogan, to serve on task force and committees, and NAMI's expertise on policy and advocacy matters is really valued at the state level, and so they do a lot, all day, every day, even on Saturday and Sunday. I'm learning. Reporting and communication. So one of the things Kate stressed when she brought me on is making sure that NAMI affiliates and NAMI members are aware of what we're doing, which I think makes complete sense. So we have developed an entire communications calendar, and I'll be working with Kate and Danielle to make sure that we're getting out regular policy and advocacy updates so folks can follow and folks can take action and contact their legislators or come to Annapolis and help us out. And doing conference calls and being available to help troubleshoot, answer questions, say, yeah, I need you to talk to your state senator. Can you come to Advocacy Day and help us out? So really engaging NAMI members is going to be a priority for us going forward through session and through the rest of the year, actually. So look for updates from NAMI because I think the first one's already gone out, but they'll be coming to you regularly. And then I would say the last is relationship building. I, use my decade plus of experience down in Annapolis to help get NAMI's priorities in front of the right committees and to sway votes and help members understand why our issues are important. And I also work with Kate because she has got relationships at the executive level with a variety of cabinet secretaries and their staff. And so making sure we're keeping everyone in the loop is a little bit of a job in and of itself, but that is something else I help NAMI with. There's more on this list, but this is kind of the broad overview of what I'm doing and what NAMI can expect from me in terms of service. So I'm happy to stop here and answer any questions you might have about that, and if not, we'll keep going. All right, great. So these, I'm sure you've seen, they're NAMI Maryland advocacy values. I think they're also nationals values. So this is the part of the broader strategic framework that we use to help us decide on legislative priorities. So families and individuals with mental illness are the experts. Effective, peer-based, recovery-oriented programming and services. Engaging volunteers and community partners. NAMI values confronting the profound injustices associated with mental illness. NAMI also values diversity, inclusion, and cultural competence. So these are our guiding principles and kind of our North Star. So if we're trying to figure out what's important and what's not, this is enormously helpful. And then we try to turn our values into action. So how do we develop a legislative agenda and our advocacy priorities? So our advocacy priorities change sometimes slightly, sometimes greatly from year to year, but those are the broad outlines of what NAMI plans to work on during session. And I say broad outlines because last year there were about 3,000 bills introduced. And so some of our approach is proactive and some of it's reactive, but we need to maintain at least a little bit of flexibility to make sure that if something big comes up, we can step in. I think a great example last year is the red flag law. It was really a gun bill proposed by gun violence prevention advocates, and they brought NAMI in the waning days of session, and NAMI was able to advise the Senate Judicial Proceedings Committee on what happens in these situations where families, providers, individuals need to appeal to the courts or law enforcement to get guns out of the home. And so we looked at it as primarily a suicide prevention effort, but it was something that wasn't really a part of our agenda, and we made it work and fit in because it was really important, and we couldn't have predicted it was coming up or that we would be in the back room until midnight helping to write the bill and on the phone with our members and our coalition partners to make sure we got it right. So the bill went into effect on October 1. It's had a really, really meaningful impact in the handful of states who have already passed similar laws. So it's a step in the right direction, and I'm sure there will be corrections, but that's just one example of where flexibility comes into play, and there's a shifting of resources and priorities on the fly a little bit so that we can do the most good where we can. So ideas and priorities for bills come from NAMI Maryland staff, they come from grassroots members, they come from the board, and they come from our legislative coalition partners. That's pretty self-explanatory, but again, it's a collaborative and ongoing process. Really quick overview. I'm sure since this is the advocacy session, you guys are already pretty well versed in this, but the legislative process, January to April, 90-day session. The opening bell rings at noon on a Wednesday, and we're really going and going and going. This year, we'll have probably about a third new members, and so a big push from us will be member education, letting them know who NAMI is and the services we provide in their communities and hooking them up with their local members, because a lot of these folks haven't served before, may not have interacted with NAMI, and may not be aware of our priorities. I think we can expect close to 3,000 bills again. If your bill is introduced on time, every bill gets a hearing. Not every bill gets a vote. Annapolis is a very committee-based system, so you get a bill assigned to a standing committee in the House or the Senate, or both. And then once the committee makes a decision about the bill, you know whether it will pass or fail, because fortunately, not all the legislators have time to review every bill, and so they look to the committee to make those decisions and bring people together and work on amendments. It's certainly an imperfect process and sometimes results in incremental progress, but it's what we got and it's what we do, and Maryland is better than most and proud to work there. The operating budget, NAMI offers testimony in both budget committees on a wide variety of things: provider rate increases, better staffing for inpatient facilities, forensic bed increases, We worked on clinical reimbursement rates for peer support specialists. I mean, you name it, if someone is getting paid by the state, we're advocating for it. And if you're not sure if we are, let us know. We will work on that. Other critical elements of the process, so I touched on proactive versus reactive. A proactive approach is where you go in, you know you're gonna introduce a bill or do a budget item, and so that work probably starts in December, November potentially, with securing bill sponsors, meeting with some leadership, getting together an advocacy coalition if the bill calls for that, really laying the groundwork so that your bill can be filed on time, you can get an early hearing, and you have time to work on that bill during the 90 days of session. Reactive is we can't predict every bill that's going to be introduced. Some people call NAMI. Kate and I were on the phone with a delegate who hasn't even been sworn in yet, and the Senate Judiciary Committee vice chair last week, and they were telling us about a bill they wanted NAMI to sponsor. So it's starting, but not everyone gives us that courtesy. So we will review bills, bring in some of the policy and advocacy folks to give advice, talk to subject matter expertise if we need to do amendments, and then we take positions, we offer testimony, we work on bills. I think I've covered member education, working collaboratively, so that's a lot of work. We're a member of the Behavioral Health Coalition. I think there are probably 50 plus members. We're a member of the Behavioral Health Criminal Justice Partnership. We're involved in their CIT subcommittee, the Justice Reinvestment Act subcommittee. So it's just kind of goes from there, but that's a lot of collaboration, which can make our reach wider, but also is tough when we're not on the same side of an issue. So legislative session 2018. These are our advocacy priorities. So we use our values to influence our advocacy priorities, and this is what the staff proposed to the board and the board approved. And these were our guiding principles for legislative actions we took last year. I'm happy to read them to you, but I'll spare you. So number one is funding. Number two, parity, which it sounds like the parity session was not to be missed, and folks came out really revved up, which is great because we'll need your help on a lot this session. Reducing legal other barriers that prevent access to timely and effective services for individuals with mental illness and their family members or caregivers. And then the fourth one is improving the criminal justice system's response to individuals with mental illness and their family. So these are broadly what guided our work last session. And during session, we tracked and followed more than 100 bills. This is just verbal testimony in the House and Senate. We testified on at least 25. Most bills are introduced in both chambers, which means we are sitting down in front of standing committees about 50 times. So almost every single day to talk about a bill and explain our position and propose amendments to oppose or support. And on the operating budget, coordinated an advocacy day with NAMI members from across the state. We'll be doing the same this year. I wish I had a date for you. Lawyers Mall is going to be closed for the next 2 years, and so we're trying to figure out with our coalition partners what's a creative alternative to a rally, because I think that visual is really important for legislators. They need to know how much behavioral health is important to them, especially with a new crop of legislators. So we are talking about great grassroots advocacy ideas that will make a big impact and make the legislators feel like these people are paying attention and I need to vote the right way. So if you have any ideas on that, we were thinking about a march, a candlelight vigil, virtual advocacy days. So there's a lot being discussed, but we will get that date out to you as soon as humanly possible so you can put it on your calendar, make plans to come to Annapolis. Last year was a great year for behavioral health priorities, and I don't know if you've seen NAMI's end of session report. We'll would be happy to share it with you again, but there were a number of really important victories. Priority number one, $16 million to support the behavioral health workforce. That was a fight. We passed a bill that required a 3.5% provider rate increase. I mean, these are the people taking care of our family members in our community, providing treatment that we need and that we know is so hard to access. The governor cut it from his budget, so we had to fight back on that and get that back in. So that was $16 million. $2 million for a collaborative care pilot. A lot of folks get their mental health treatment through their primary care provider. Sometimes that works great, sometimes not so great. So the collaborative care pilot is really bridging those services and knowledge gap between primary care providers and behavioral health providers, and they're the folks they serve. And then $12 million over 3 years to improve crisis services. So there's, or I think it's 4 because it's yearly grants of $3 million. So there are a handful of counties in Maryland who have implemented crisis intervention teams, and they've got assertive community treatment plans and are hooking people into services. And then there are a number of counties that don't. So we are prevailed upon the state to give those counties the resources they need and required them to report back what they're doing and to beef up resources in counties that are already providing pretty good service. So the focus of these grants, they flow through the Behavioral Health Administration to local community support agencies. So it's, the focus on services, I think, will be very healthcare based, which is important. And so we'll be following that. There's a lot of reporting requirements and an ongoing work group to make sure that these grants are appropriately implemented. And I won't bore you with the rest. Priority number 2 was parity. NAMI did a lot on parity. One of the major things was that Care First and a number of other insurers said, we're gonna have to increase premiums by at least 50% on everybody. So we supported and worked on a controversial package of bills to stop those premium increases, to create a reinsurance program to capture the people who were kicked out at the federal level from ACA reform and the Medicaid expansion, and to really bolster what Maryland has done in terms of healthcare reform here. So those bills were described as propping up our healthcare system, and they are, but that's important because if people can't afford healthcare, they're not going to access the services they need. We also supported legislation to determine a path to clinical reimbursements for peer recovery support specialists for substance abuse and mental health disorders. So that started out with just doing reimbursements. The state's not sure how they can make it work, so we're part of a stakeholder effort to make sure that that is part of this year's budget. Priority number 3, reduction of barriers to treatment. We passed legislation and partnered with an advocacy coalition partner here in the room to keep individuals in treatment and prevent a hearing officer from ordering hospital release after 30 hours in an emergency department. So that was actually a really good success, and yeah, thanks. Thank you to Evelyn for bringing that to our attention. It was a good victory. We held the state accountable on inpatient staffing requirements to meet the growing need for inpatient beds and treatment. There's been a small uptick in beds, but the state doesn't have enough care providers. So working with them to make sure that they do and requiring them to tell us about what they're doing pretty regularly. And we supported school safety measures to increase services and reduce stigma. After the high school shooting in St. Mary's County, there were a number of bills introduced to, I guess you could say, combat school shootings or anticipate them, or and the talk thankfully turned to services. And when we're talking about gun violence issues, when we're talking about school shootings, a big problem is that these kids, transitioning age youth, are not getting the services they need. They're not getting diagnosed early enough. And I think the way that a lot of people talk about it really contributes to stigma. And so our goal in consulting with folks on these late filed last-minute bills was to make sure that kids are getting in-school behavioral health supports that are appropriate. And there's a wider effort, which we'll talk about in a little bit, to make sure that these are in place in every school. But we were very careful and very corrective in talking about stigma and, about how shooters are violent and not mentally ill, and please stop making that connection. It's offensive. Sorry, this is my own personal. Priority number 4, improve the criminal justice system's response to individuals with mental illness. So NAMI is unique in that we work with the ACLU, Civil Liberties Division, and we work with the Prisoners' Rights Coalition, a number of other groups that are kind of outside our healthcare, wellness community. And that has really, I think, been beneficial. Kate, in particular, is an expert on these issues. And so NAMI's been able to bring a perspective in committees that usually hear from law enforcement and they hear from civil rights groups. And they don't really, social justice groups, not a lot about where the criminal justice system is colliding with the behavioral health system. So we've been able to provide that perspective. It's really important and valuable, and I think has gone a long way to protecting the civil liberties and rights of folks in Maryland, and making sure that incarcerated people are getting better services, they're getting better treatment. So the Behavioral Health Crisis Response Grant Program, those are those CIT grants I talked about earlier, $12 million over 4 years, I believe, and then crafted and passed a red flag law with potential for suicide reduction. So that's a lot. That's a lot of work to do in 90 days. That's a lot of funding. It's a lot of positive movement in the right direction for individuals with mental illness and their families. And our hope is to continue that good work this session. So before I start talking about 2019, I'm happy to stop and answer questions. And yeah.
So your 4 priorities here, I know that you said earlier, the legislative process is January to April.
Mm-hmm.
So all of the time after April up until January, are you working on these 4 priorities every year so that you can present it in January to April? Because it seems like these 4 are really successful. So throughout the rest of the year, are you just looking at bills that are in line with the 4 priorities you have?
That's a great question. So what we're in the process of doing right now is reevaluating the 4 priorities for the coming January to April session. So what we did from April pretty much until now is all of these successes and bullet points had implementation and additional work. But broadly speaking, there are probably progress and improvements we can make under those 4. And it's not really for me to say, will they change drastically, will they not? That's more of a board level staff conversation. And I'm here to advise and provide feedback about what I think the likelihood of something happening is. But right now, those conversations to figure out what the 4 priorities are ongoing, and I think we're having a call December 10th with NAMI members to go through them and talk about what we know for session and what to expect and where things are in our planning process. So folks will feel on the same page before session even starts. Oh yeah.
Also to be aware that those priorities are advocacy and policy priorities, not just our legislative priorities.
True.
So that they guide, what we do on a coalition, whether we join or for a high priority on a new potential project or coalition. But it's also, whether we're going to work on something that may not ever get to legislative.
I would just add one comment, because I think that continuum between legislation, advocacy priorities, and regulatory stuff, and follow-up, and all of that is just a continuous thing.
Mm-hmm. Yeah.
It flows in one direction or another, depending on the section underway or not. And I've got an appreciation for just how fluid all of it is, day to day, right?
Yeah, you do your best to control it, but there there are things that, Kate's right, we're working at the state and local level year-round that aren't necessarily bills, but are guided by these priorities.
Okay, so those are like your building, I think I was
Yeah.
trying to say, these like your building blocks.
They are.
We are gonna start at these 4 priorities and we're gonna do our best. But these are our pillars.
Exactly. And then we kind of see, first of all, who wants to work with us on a bill, or what idea do we have from a board member? Do they fit under the priorities? And then taking a look at bills that are introduced and what our legislative partners are working on, and using those to guide us. So yeah, the pillars is a great, I'm gonna steal that. That's great. Great way to explain it. Any other questions about 2018 or?
So we can assume that all of these things you listed here passed or signed.
Yes.
As it, well, you know, may or may not have been implemented, but they're law.
Right, correct.
Well done.
Thanks. Credit goes to NAMI.
I went ahead and quick question
Yeah.
on that. What is the outpatient civil commitment pilot?
Sure.
Can you give the status?
So Maryland received federal funding from SAMHSA to develop an outpatient civil commitment pilot project. The pilot took a long time to get off the ground. It was centered in Baltimore, surveying voluntary and involuntary patients. NAMI is a stakeholder member of the group. The state's report on it isn't public. I think what anyone would tell you is that the small number of people served, their outcomes were beyond impressive. And I think that was very encouraging to some of the folks who are resistant to involuntary treatment. It's not a panacea. It's not gonna, really solve the differences between us and folks who don't believe in that. The outcomes were good. They weren't good enough, and the pilot didn't get going soon enough to meet all the federal requirements. So SAMHSA pulled their funding. The state, through the Behavioral Health Administration, has committed close to, I think, $400,000 to continue the pilot through June, in the hopes that there will be funding either to keep serving this population or to expand the pilot. The state has also said they may do some regulations around loosening the eligibility criteria, which I think was a major problem to getting folks to participate. Also working more closely with hospitals and health systems to make sure they're aware of who qualifies and how they can be helpful in working with us on outpatient civil commitment. So it's a good news, bad news scenario. I think the state report is due by the end of December, if not sooner. And frankly, I'm not sure how much beyond that I'm permitted to share, but that's virtually all I know and all they've disclosed. Oh, did you have a question? Oh, okay. All right. So moving on to 2019. This is just a sample of things that Kate and I are running up the flagpole. So we are meeting with legislators. We're talking in some cases to state agencies. And we're forecasting what may or may not be a hot issue this session and something that is ripe for folks to want to work on or the state to fund. So none of the, yeah? Oh, I will. None of it's been approved, or this is very broad outlines and a bright red subject to change. Yeah, so the first one is budget advocacy. That's ongoing and continual. Our provider rates are not competitive. It makes it really hard for us to attract and retain talent. It makes it really hard for Maryland to provide services, inpatient and in the community, that we need to serve folks with mental illness. So that's always something I think NAMI will be strong on and participate in because it's critically important. Outpatient civil commitment. So the state's indicated there may be regulations they're doing. It may be a bill. I'm not sure yet, but I think if there's progress to be made there, we want to be a part of that conversation, and in fact, we want to be leading that conversation to make sure that families aren't left out of the equation and that the state is as aggressively providing services to folks as they can be. So that's on there, and not a great timeline on what we'll have ready to go before session, because some of it's dependent on the final report and what the true outcomes were from this pilot. But we're aware and have our antenna up. Expanding the crisis intervention team model. So the behavioral health crisis response grant program is great. I would say it's a little bit more services and healthcare focused. A key partner in crisis intervention teams is, of course, law enforcement. So we've been talking with legislators on what a good model looks like to provide the support to law enforcement training, education that they need to identify, to de-escalate, to help this population get services and not into the criminal justice system. Okay, all right. Thought you might have something to add on that one. Parole and probation mental health recidivism reduction project. This is one Kate has had in the pipeline for a while, but it's working with the State Department of Public Safety and Correctional Services to help parolees and folks who are about to leave prison or jail do NAMI training, be prepared to stay in recovery, be prepared to own their wellness, and to hopefully help take a bite out of our recidivism rate, and I think also address some of the service gaps that currently exist from the care people receive when they're incarcerated to when they're released into the community. So that'll be a really, really important project for NAMI. And this, again, may be one that it's not so legislative in nature. It's something she's been talking with the department about, and we may need a bill and we may not. But that's a great example. One, restrictive housing and populations with severe mental illness. This is something NAMI has worked on for a number of years, but when it comes to solitary confinement for folks with severe mental illness, pregnant women, a number of vulnerable populations, we don't have a great track record and we're not doing enough to protect people who are serving time. So that's an issue that's going to come back in one shape or another, and you can bet NAMI will be at the table and working on that. Medication-assisted treatment, getting more aggressive on that, whether it's in the prison population, community, statewide. That's a hot issue. Legislators have been looking at it for a couple of years. There was just a really interesting op-ed in the Baltimore Sun, in-school behavioral health services. So building on some of the legislation in response to gun violence last year, the state is actually looking at transforming the way we fund education. And so behavioral health services has been a part of that, and in-school services. So looking at that funding, looking at what they're proposing and making sure it's helpful and not harmful and it's adequate and makes sense. Treatment capacity, so what's happening to folks when they're in the ER, how, inpatient services were always above capacity. So these are, generally speaking, what we're taking a look at as we're building our legislative agenda and revisiting our 4 pillars. So balancing, with NAMI and staff, what are our priorities? What do we have the capacity to work on? Who may be working on something that we could partner with and put our efforts somewhere else? So these are the issues, building the pillars, and that's about it. Go ahead, Kate. Oh. It's refers, I think, primarily to substance use disorders. So it's providing the drugs to help people kick opiate addiction and being more aggressive with those, and I think providing better rates, better coverage. Yes? Wow.
Is that something that Maryland
Yeah, to my knowledge, that hasn't been a part of the discussion. The General Assembly is charged with one thing and one thing only. It's to pass a budget, primarily to fund our health system and public education. So we've got a really strong local education board set up, and they're the ones who dictate curriculum. And there's usually a little bit of an annoying turf war when the general, because they've tried to mandate financial literacy. They tried to do the go to school after Labor Day, and the locals get very angry about that. But I think in the context of this conversation and providing in-school services, that makes sense. And we're already doing health classes, and why isn't this part of it? So yeah, worth having the conversation.
I would add one additional thing, and that is that over the years, there's been discussions, we've been trying to have discussions directly with the Department of Education that can actually insert in all, make recommendations and provide material that can be inserted in already existing required, health segments where the health, you need to do it, and here is the pieces. So there's another way to go at it that could be, it comes up periodically, and that's a really good suggestion. I think it needs to be, I think the last time I had a discussion on that was 2 years ago. It would be, I'd be interested in trying to do it. We found it to test the waters for legislation, but then also think about these other macros.
Yeah, I mean, if maybe the schools are getting money from Kerwin to do some mental health, they need to require the education. Or there's ways to do it. That's really, really a great thought. Thank you. Other questions? We've got a little bit of time.
All right.
Okay.
Could you speak to it? I'm not sure if it's Tabor or more, but you mentioned the reporting and communication strategy. Can you speak in more detail on what that would look like and when, how often, and in related questions to that,
Yeah.
you also mentioned back and forth with grassroots NAMI members in the state. How is that process going to go with the
It's going to be a two-pronged approach here, okay? I don't want to put Moira completely on the spot here. Several things. One is, actually, I was just, we haven't done for 2 years an actual feedback survey out to the grassroots. So there's different levels of, what I call a feedback loop, which has not been done well. Okay, so we've got a ways to go. But there is a plan, and it includes not only getting information out, and Moira has started doing updates and overviews. The first one went out to affiliate leaders just recently. There'll be another one that, and again, if you haven't gotten it and you consider yourself an affiliate leader, go to your executive director and or the president of your board or whoever has been designated as the public policy liaison to NAMI Maryland, which is a requirement of affiliation, and make sure that that is up to date, so that, because we have been told by some affiliates that we should only, we cannot go to certain people. We shouldn't go to their president of the board, they shouldn't go, so we need to make sure we're sending it to the right people, okay? So if there's an issue, we have 1 or 2 people at each affiliate that we're sending this to, unless you're a Model B affiliate, in which case the entire steering committee gets it, okay? Because they're part of us. So making sure that that gets to the right people. We've asked that it be then sent to that one contact, we did, and then that contact send it on to the appropriate people that the affiliate feels is appropriate. Then there will be a regular, similar but less detailed missive to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, so that's another way to reach out to, to everyone who gets our emails. Okay, the many people who might have taken our programs but may not be getting things from, we want to get to a lot of people. Okay, so there will be that kind of getting information out. There will also be what I started to say, we haven't done this for 2 years, is sending out a survey, another survey. Some of you get our surveys, but this would be a survey that's pretty broad, saying what do you think are the important policy and advocacy issues? What is important to you, and who are you? And also getting that and asking affiliates to please send it out to their contacts, because we do not necessarily have, we can't reach all the grassroots. And as part of that, we also are going to slice and dice that, frankly, based on who's answering it, because somebody might get our email and they might be someone who's just interested in, they're interested in getting our stuff, but they're not a core stakeholder. Or we want to know where they're from, so we know where in the state this is an issue. So we will be analyzing that, and that will be the first one of those should be going out soon. And then we do periodic surveys. We do ask that if we send a survey out, that anyone who gets it, including affiliate leaders, feel that they should be able to forward it on to many other people, so we can really get a full picture. And then we do that on specific issues periodically. Those kinds of surveys are done partly to deliver information about where we are, where NAMI stands, but also to invite people's opinions, but also their personal experience with this issue. And even if they have a personal experience, would they be willing to share it in writing, anonymously, or perhaps even come to Annapolis with us and provide it as testimony. So we're always collecting that kind of information. We need to do it on a better and less reactive way. And so that's part of what the communications plan is going to be, is how do we get information out? How do we get it back? How do we analyze it? How do we use it? And then how do we then keep people as up-to-date as possible without, frankly, making it impossible for us to actually do the work. And so it is going to be, we're going to do our best. We have a long way to go. It is one of the things that I would grade us as a D. And I think we can be an A within a year. How's that?
Sorry, 2 quick things to add. At the very bare minimum, weekly updates during session.
Oh, yes, I'm sorry.
Yeah, beyond the regularly scheduled advocacy updates. And then a whole sort of section of things that I'm helping Kate and Danielle with is press and media. So Kate was recently quoted in Mental Health Weekly. And I think NAMI Anne Arundel should have a letter to the editor coming out in the Capital Gazette, raising awareness about some behavioral health issues before session and before the election. So we'll be doing some more strategic comms, stuff like that. Thanks.
And talking to affiliates, leaders, where there's an active affiliate, to engage them.
Janet? Mm-hmm. Like, call your legislator, we need testimony, that kind of stuff, yeah. Mm-hmm.
I would consider that one thing that we have done. No legislative alerts. Thank you. I mean, some of us have gotten them. So this is another thing. Another question is how are we getting things out? Are people I was unsubscribed from I'm the executive director of NAMI Maryland. I was unsubscribed from our e-list twice automatically somehow. So we've got some ways to go. But if you do not get things that you think you're supposed to be getting, now one, we might not be doing it, but the other is you may not somehow be getting it for one reason or another. So we need to know that. Okay, well, and I would say that we are careful with how much and how often we do that, too. You should not, well, and those of you who have, there are differences of opinion, but we're going to be looking at how often and which things we want to inundate people with phone calls and emails, which ones we feel we may be more effective by getting the right testimony and the right stories, or helping to be involved in writing the legislation in the first place. So picking, if we think we've got a good chance, we may not send out an alert. But you're right, I mean, we need to be looking at that, but we also need to be looking at who's actually getting those alerts. That concerns me very much.
I think Tina has a question.
Yeah.
Moira, can you describe virtual advocacy and especially what is the reaction or results with the General Assembly from this?
Virtual advocacy is supremely helpful, I think, especially this year, because members of the legislature will be, relatively speaking, a little bit younger, and I think they have, throughout their campaigns, realized how effective it is to engage with people on Facebook, and frankly, you see some very hearty debates happening over Twitter or Facebook, either via Messenger or comments or direct replies to folks. So shouting out your legislator, I would say to try and do it for good things as well as bad things, is a good way to ensure accountability and to say, hey, I'm back in Montgomery County, but I'm watching what you're doing. And even soliciting information can be helpful. So if you say, I mean, I'm here to answer these questions too, but hey, Delegate Moon, I want to watch this hearing. How do I get it? Or do you know when it'll be? They work for you. They're your resources, and engaging with them regularly is a great way to increase NAMI's reach.
And one way could be, well, this is one of the priorities that I'm concerned about, and I don't necessarily mean a specific piece of legislation. I mean like one of those priorities, or one, this is something I'm very interested in, or that I'm a member of NAMI and NAMI is very interested in this. Where do you stand? Yeah. With especially new legislators, they're fertile soil. So,
sometimes more immediate responses than a form email, frankly, because they get thousands. So.
I don't want to follow up on that.
Any other questions?
I would just add that, and we're going to follow up about that specific question, an issue. I really want to explore it. But to the extent that you have not just complaints, because as I said, I already gave us a D. So, but ideas, requests, suggestions. Relationships. Yes, relationships. Helpful things are really great. And then questions and suggestions. Can't guarantee, though, that everybody will get exactly what they want, because we're a big movement. But having your voice heard, and then also if you have something on a non-legislative, topic, but if you've all brought, I've heard through all these sessions, I've heard people raising questions that they have, either because it's a personal relationship issue or a topic, or because they're just interested in that topic. If you are interested in something and you know somebody who might be interested and might have some decision-making or influencing capacity, or is part of a large organization that might be interested in this, like you're a school teacher or you're a parent of teachers and you want to talk about this education and what kind of education is there around mental health in the health curriculum or whatever. If you want to bear with us, we might not be immediate, but if you want to ask us, do we have any materials, or do we have this question, or do we have this issue? Do we have any FAQs? Is there something, if you're going to be talking to your professional organization or to your faith community about some issue? But also feel free to just, you know what the issues are, right? You live it every day. Feel free to use our priorities, but then speak and tell your stories. And then to the extent we can help you, we will do our best. We just have a ways to go to get up to perfection. No, we really have a ways to go. This is not one of our areas that we've been great at. We do a lot of other really great stuff behind the scenes. Bringing Moira on and her team on pretty much full time, I think is going to make we're going to help because we've prioritized certain things, including communication and other things. So I'm hoping, I know this is going to work out really well. But now's your chance to give suggestions because we're really building it now. So thank you.
Some of our affiliates have close ties with the legislators who are committee. And I understand whether you take them, the local people you want with you, not just for stories, but you have relationships with some of the legislators.
Absolutely.
And affiliates are underutilized.
Absolutely. And so one thing I would ask, I think that's absolutely true. Okay. We don't always. We might think we might know. Might think we know. We might have been told once or twice, but don't assume that that we have it right on our radar at this moment. We're going to be doing a mapping, but telling us who has contacts. One of the mapping that I'm talking about is making sure we try to keep track of who does have those contacts. That history does not always transfer. So yes, it's really, really important, and it's also important to let people, to help people recognize that they might have contacts that they didn't realize that they had. Like, I have a neighbor who works with so-and-so's wife. I mean, that's extreme, but, you know, I mean, at the grassroots, and your family-to-family teachers, your support group, you know, you all know right away who you know has contacts. And Howard County and some of our other affiliates are pretty amazing about that. Beyond that group, there are also opportunities to empower other people to realize that they have contacts, that they can use contacts, or to find out what those contacts are. And I'm looking at Elizabeth, where we've got a constituent relationship system where we've been trying to, you know, put that so-and-so works here, and this person knows this person. So we have a place to put it now. We don't always, that's not our first, that's Moira's first thought.
Well,
But-
I mean, Kate won't tell you this, but in last week's staff meeting, she actually brought that issue up to me and said, you know, we need affiliate leaders coming to provide testimony and doing substantive work beyond just advocacy day. So that, you know, that'll be a continued goal for engagement and creative thinking while we're trying to get stuff done during session.
Thank you for letting me. Okay. You're all where it happens. She's great, but you're where the rubber hits the road, so thank you. And we'll be talking to all of you, I'm sure.